Thank you all for joining us on this session on how we can support endurance athletes from the dental point of view. So, my exposure to endurance athletic events comes from working with endurance athletes and to a minor extent taking part in endurance athletic events in India, Oman, Malawi, Jordan, and I've also done work with the British Antarctic Survey. So using this experience, I've decided to break this session into 5 modules. In the first one, we'll discuss why endurance athletes need dental support. Then we'll discuss how do we prevent it. Finally, we will discuss that however much we might want to prevent these incidents from taking place, there's still a high chance that we will face with dental emergencies during an endurance athletic event. So how do we provide the dental first aid? How do we examine, diagnose, and what we can do in the form of treatment, as well as how do we manage dental injuries? So why do endurance athletes need dental support? Let us look at a few statistics. Endurance athletes have 55% chance of totally eroded teeth. In a normal population, you have like approximately 18% of us who have worn down teeth. In endurance athletes, that statistics increases to 55%. In a normal population, you can vary, but approximately get a 10% chance of gum disease. In endurance athletes, this shoots up to 76%. Tooth decay affects 31% of the population. In endurance athletes, it goes up to 75%. Dental problems affect 18% of endurance athletes in their training. During mountain biking events, there is a varying statistics of from 6% to 20% where there's reported dental injuries. In endurance trekking, 16% chance of medevac takes place because of dental emergencies. So why should you as a non-medic be involved in this field? Dental pain and dental emergencies are generally totally preventable. By preventing these from taking place, you can protect the team from the added stress which these incidents can cause. Let us just not rely on a medic to deal with this, to prevent this. You are an active part of the team and can contribute into the initiation, propagation, and prevention of these incidents from taking place. By preventing these incidents from taking place, you decrease the stress level of the entire team and generally just improve the overall experience of this event if the participant of the event is not involved in dental emergencies or dental problems. And also our main factor will be to prevent or restrict medevac as much as possible. So why are endurance athletes plagued with such a high rate of dental problems? Now, during an athletic event or training from an athletic event, the diet tends to change. Your sugar intake goes bang straight up through the roof. Not only is the quantity of sugar intake goes up, but also the frequency, how frequently you take the sugars go up, and your general diet shifts to the more acidic level. So therefore, let us see how this affects your dental and oral health. So if you're training and you take one sip of a high energy drink, the bugs in the mouth go, "Hey, sugars," and they break down all these sugars to release acids. But the saliva is really clever. It knows that there is acid in the mouth, immediately buffers this acid and repairs all the damage done. But you follow that one sip by the second, third, and fourth, by multiple sips. So the bugs in the mouth think, "Wait, it's Christmas time." And the amount of acid they form is much more and for a longer period of time. So the poor saliva cannot buffer all this frequent exposure to acids. So these acids then cause two things in the mouth. They cause the teeth to get really soft. So the top teeth then rub on the bottom teeth, totally wearing them down. So the tooth wear increases. Now this damage is of non-infectious nature. It's strictly mechanical, where the teeth are softened and the top teeth wear against the bottom teeth. Also, washing the teeth with acids dissolves that part of the tooth which is the most predisposed to that sort of an acid attack, and that is the neck of the teeth. In the neck of the teeth, the outer hard structure or the enamel of the tooth is really thin. So therefore, the acid attacks the teeth around the neck, dissolves through the enamel, then comes to the second layer of the dentine, washing it away, giving a eroded appearance around the neck of the teeth. Again, this is of a non-infectious nature, whereby it is just a chemical wear of the tooth. The teeth can also be dissolved by the acids to form caves. Now these caves collect food and debris. This food and debris releases more acid dissolving into the tooth. This causes multiple dental decay. So this effect of the acid is infectious in nature, where you're having rampant dental decay in your teeth. Now, all we know that when we take part in endurance events, it's difficult to keep up with your fluid intake. First of all, you have an increased fluid loss, decreased fluid intake. Added to that, you have the predisposition of increased mouth breathing, further increasing your fluid loss, further affecting your fluid intake. So the balance gets affected, and this results in a dry mouth. You're tired, exhausted, and worn out, and it's difficult for you to maintain a good oral hygiene. So exhaustion, of course, plays a factor in it. But from previous studies, we also know that the peer group around the athlete is focused on its training. Oral hygiene is way down their priority list. So therefore, mixing in this peer group, the athlete decreases the motivation and the oomph to maintain a good oral hygiene. In the events which take place or during the training, very often the facilities are less, so that is another factor which affects in maintaining the oral hygiene. So all these three things together, bang, increase the rate at which damage is caused to the teeth and the gums. The athletes are also exposed to sensitivity, not only by the environment where they are, for example, in altitude or in freezing cold weather, that increases the sensitivity. But as we mentioned before, their diet is essentially acidic, and this acidic diet dissolves the tooth surface, making it even more sensitive to hot and cold. Just by the nature of the athletics, you may be predisposed, as I said, from 6% to 20% chance in mountain bikers to have front teeth injuries. This is caused by the event, as well as the exhaustion caused by the long endurance event, as well as, of course, you have the factor of teeth arrangements. Teeth arranged in these factors will be more predisposed to dental injuries. So all these three things causes much higher rate of dental and gum injuries in athletes involved in endurance events. So what can we do? We must try our best to prevent it, but if we can't prevent it, then we have to treat it. So how can we prevent it? We can prevent it firstly by motivating the athlete to enter into a strict oral health coaching. They can pretend that their dentist is their oral health coach. Their dental therapist is their oral health coach. because they belong to the category of individuals which have such a high rate of dental disease and gum disease, they come in what is known as a high risk group. So ideally, they should go to the dentist 3 times a year, so every 4 months, not every 6 months. At least they should visit the dentist 2 to 3 months before the main event. Why? Because this will give the dentist a chance to do the complicated dental treatment if the athlete needs it, as well as gives the athlete a chance to recover from that dental treatment. Also, during this checkup, because they are in the high risk group, they can have a tropical fluoride varnish placed on the teeth. Now, we do it to all children 3 times a year, but individuals like endurance athlete in the high risk group can also have access to that, and this will considerably protect the teeth. Now, we know the best way to prevent dental and gum diseases for endurance athletes is to limit the factors that cause teeth and gum problems. Now, we know that sugar, not the quantity, it is the frequency of sugar which causes the damage to teeth and gums. So we can reduce this. But let's look at it realistically. Realistically, that is really hard to do because you need the frequent sugar exposures during your training or during the endurance event. Now, because we know practically that is not possible, let us balance it and see how to protect the teeth against this onslaught, frequent onslaught of sugars and acids. So we can protect the teeth mechanically, we can protect the teeth chemically by medical means, and we can protect the teeth physically. So let us see how we can protect the teeth mechanically. To protect the teeth mechanically, we can promote flossing. Floss is the thread which goes between the teeth and cleans all the dirt out between the teeth. So first, you floss your teeth once a day. Then you got to brush your teeth. You got to brush your teeth in the right manner twice a day for 2 minutes. Now, we suggest that the brushing should be done at least 30 minutes after food. Why? Because food gives rise to acids. Acids soften the teeth. We need the saliva to buffer the teeth sufficiently before we rub them with a toothbrush. So that is why 30 minutes after eating, we advocate brushing your teeth. This should be done at least twice a day for 2 minutes. Now, after brushing the teeth, we strongly suggest spit out the excess toothpaste. Do not rinse your mouth. Why? Because toothpaste contains higher fluoride than mouthwash. It's stickier than mouthwash. So we do not want to wash it away with a mouthwash which has less fluoride and it's less adhesive to the teeth. So by spitting and not rinsing, we're increasing the efficacy of the toothpaste by 25%. Electric toothbrushes are better than normal toothbrushes. Why? Because they brush the teeth better. They prevent you putting a lot of pressure on the teeth, and they generally do a very good job. They also have a timer in them to make sure that you are brushing your teeth for the full 2 minutes. We strongly suggest that the athletes or anyone does not use a very hard toothbrush to scrub their teeth with all their might. What this aggressive and vigorous toothbrushing does is that it pushes the gums down. As it pushes the gums down, it exposes the neck of the teeth, the Achilles heel of the teeth. And at the neck of the teeth, the enamel, as I told you previously, is very thin. So this brush then cuts grooves into the enamel, further increasing the sensitivity on the teeth. If you use an electric toothbrush, that will prevent you putting this excess pressure on the teeth, because for an electric toothbrush, you only have to touch the toothbrush to the tooth surface. Pressure is contraindicated. As I said, avoid using mouthwash. It is not necessary to use a mouthwash. If you do want to use a mouthwash, you can use it in the afternoon as a top-up, but not after brushing your teeth. And definitely not the mouthwashes which contain alcohol. That is because alcohol has a tendency of drying the mouth up, sucks the moisture away from the mouth. This further dries the mouth up, and it also kills the good bugs and the bad bugs in the mouth. So you should avoid using mouthwashes which contain alcohol. How do we protect the teeth chemically? By using a good toothpaste. A high fluoride toothpaste is brilliant for endurance athletes due to the high degree of fluoride in it and the way it works. However, this can be got only on prescription, though occasionally you can get it off the shelf. It's mainly on prescription. In the United Kingdom, under the NHS, you can get up to 4 tubes of these on a single prescription. So let us say you cannot get a prescription. What are the off-the-shelf toothpastes you can use? Now, if you are that type of a person with excessively sensitive teeth, you can use an anti-sensitive toothpaste. Now, there are certain factors you must remember about the anti-sensitivity toothpastes. Now, these toothpastes take time to act, so you must be patient with them. Ideally, you should start it 1 or 2 months before you are in a high altitude or a cold weather area, giving them enough time to act. You cannot mix and match. You have to stick to the same anti-sensitive toothpaste throughout. Why? Because each of them work by totally different means. So if you use one and then you go to the supermarket, find there's an offer on another anti-sensitive toothpaste and you buy that, that toothpaste will wipe off the barrier created by the first one and try to put its own barrier onto the tooth. So therefore, you must stick to the same anti-sensitivity toothpaste. You cannot mix and match anti-sensitivity toothpaste with a normal toothpaste, because the anti-sensitivity toothpaste will form a hard barrier in the tooth. The normal toothpaste will wipe that barrier off, so therefore decrease its efficacy. The Sensodyne Repair and Protect is a good anti-sensitivity toothpaste. Why? Is because it has a medicine in it called Novamin, which forms a very hard barrier on the tooth. And also it does not have that much medicines, or it actually does not have medicines which cause foaming action in the mouth. Some of us are allergic to that foaming medication. This does not have that. And because it does not foam so much in the mouth, it's easier to spit and not rinse and leave it on your teeth. Now, if you're that type of an individual where you have been exposed to a lot of tooth wear, your teeth are wearing down, you can think of getting a good buffering toothpastes like Sensodyne Pronamel. What do these buffering toothpastes do is they are very good at buffering the acidity in your mouth. They also have less bulking agents and force fluoride onto the surface of the tooth. With regards to their anti-sensitivity action, they only numb the tooth. They do not treat the sensitivity. Just got to remember that. And you can get this also off the shelf. They're very mild toothpaste, so they're not aggressive toothpaste, because you do not want to remove any more tooth structure from the already worn down teeth. And this is why we come to the last bit, is that if you want to use any toothpaste, if you cannot get hold of any specialty toothpastes, you can just use a normal, reputable, generic toothpaste. What you should not use are any of the whitening toothpastes or any of the aggressive toothpaste like the charcoal toothpaste or smoker's toothpaste, because they weigh down the tooth surface and increase the sensitivity of the teeth. How do we protect the teeth physically? Now we know that there is a large percentage of endurance athletes do get dental injuries, especially in the biking field. So therefore, we can protect the teeth by a mouth guard. You can get off-the-shelf mouth guards. However, if you have a custom-made mouth guard, they fit better, protect the teeth better, you can swallow better, you can breathe better because they fit better. Now, during an event, if you want to protect your teeth, Professor Needleman has suggested this 2-bottle strategy, is that you have 1 bottle with your carbohydrate drink in it and 1 bottle with normal water. So you have a sip of carbohydrate drink while training and follow it up immediately with water. If you are consuming gels, which we all do mostly on a long run, the idea is to gulp the gel down. Do not swish it in your mouth. Another trick is to have it just before the water stops. So you gulp your gel down, follow that up with water, which apparently increases the efficacy of the gel and also decreases the teeth damage done by the sticky gel on the surface of the teeth. Now, you tried your best to prevent dental problems from taking place. However, they will still happen and you have to be prepared to deal with it. So now, how do we do that? First of all, if a person has a problem, you will have to examine that person. So let us briefly look at establishing a field clinic, how to examine a person in the field. For a start, we know this is going to push you outside your comfort zone. So you yourself have to be prepared for this. If it is at the end of the day in a base camp scenario, there is no point doing a dental examination when you yourself is tired, exhausted, and worn out. Get something to eat yourself, change your clothes, get into something dry, and then decide to do the dental examination. When you're doing the dental examination, decide where are you going to examine this patient. If it is in daytime, you're going to use something with a good backrest and a maximum use of natural light. If it is in nighttime, especially in a jungle environment, you would want to do it in a tent. Because as soon as you put your head torch on, every bug within miles will want to join you for your dental checkup. So therefore, it is good to do this dental treatment in the atmosphere of the tent. Also, when you're doing it, prepare yourself well. Also, if you're doing it, prepare the environment properly. So if you're doing the treatment in a tent, clear everything out from the tent. Get enough padding inside to make yourself comfortable, your assistant comfortable, and the patient comfortable. Get your assistant in first. He or she is going to be a manual headrest. He will control the patient's head position and give you all your stuff which you need. Then get the patient in. Generally, the patient lies in the center of the tent with his knees bent, so you can easily move around that patient. Lay your dental stuff out properly. Now, don't forget, besides this assistant, you got another assistant in the tent who will be very willing to help you out. And he or she is a patient himself. Lovely flat chest to put things on, 2 gorgeous hands to retract, hold the flashlight to give you a hand at doing the dental examination and treatment. You may have a scenario where there's just you and the patient, where the assistants may be out doing some other work. So it's very useful to use the patient to help in your treatment, especially if the patient is dentally phobic. By distracting the patient, it helps to do the dental treatment, right? Now, more hands do make lighter work. So here you go. It is yourself doing a dental emergency treatment, one of the minions holding the flashlight, another minion holding the tray, somebody else standing around looking cool, somebody taking a photograph for Facebook. It's always a good idea to use all your hands you have. It makes the work so much more easier. What is the position of the patient when you're doing your dental examination? If you're working on the lower teeth, the position we advise is that the lower teeth are parallel to the floor and uppers are at an angle of 45 degrees. So you have direct visualization to the bottom teeth. If you're working on the top teeth, we suggest neck extended and head rotated. So you're tilting the head upwards and backwards, so you have direct visualization of the top teeth. Now, if you're working in the mouth, it's dark and it's wet. How do we get around the wetness? If you're working on the right hand side, tilt the head to the left. So as you tilt the head to the left, the saliva will pool on the left hand side. To dry the mouth and keep it dry, roll some cotton rolls and stick it on the cheek side of your upper first molars. What this will do is that it will control the flow or reduce the flow from these big salivary glands known as the parotid glands. The pipe which brings the spit from these parotid glands opens in the mouth just next to your upper first molar teeth. So if you're putting a cotton roll there, that will decrease the flow of spit into the mouth, so you'll be able to work better on the top teeth. If you're working on the lower teeth, do the same as you did on the top teeth. Roll some cotton rolls and put it on the cheek side of your upper molars, both on the right and the left hand side. And then with regards to the lower tooth where you're going to be working, roll some cotton rolls and put it on the cheek side and on the tongue side around the bottom tooth where you will be working. Another trick is, because you are not familiar in doing these dental treatments, is sometimes to practice as if you're doing the dental treatment. Pretend you're taking that filling material in and coming out. So therefore, you'll be prepared for any difficulties you might have when you actually go ahead to do that filling. So let us look at patient positions. This seal is aptly describing. It's an elephant seal. So the lowers are parallel to the floor, uppers are at an angle of 45 degrees. If you're working on the top teeth, neck extended, head rotated, direct visualization of the top teeth. Now you can see some of the medics working. They're using the wall as a backrest. Natural daylight is going in and they're working on the lower teeth. Lowers parallel, uppers at an angle of 45 degrees. This guy is working on the top teeth. The patient is lying flat down, neck extended, head rotated, and your direct visualization of the top teeth. Now let us look at the dental problems you guys might face with out on the field or helping in an endurance event. It's essentially three. 1, my tooth hurts. 2, my gums hurt. 3, my face hurts. So let us look at each of them individually. Why should the patient come to you complaining that his or her tooth hurts? There could be a hole in the tooth caused by an infection or a decay, essentially a big whopping hole or cavity in the tooth. Or the patient might have lost a filling, or the tooth could have been broken. Now your objective in these two scenarios is to clean that area and pack that area. Your objective in the last scenario is to cover that area and protect that tooth. So how do we clean and pack? Normally we suggest you carry this instrument. This is known as an excavator. The excavator has a spoony surface at either ends of the tooth. And we use the concave part of the excavator to clean the tooth, like that. If you do not have this lovely instrument to scoop out and clean the tooth, then you can use a matchstick, a floss, and I've even used the back end of a ballpoint refill to clean, scrub out all the soft mucky dirt from the tooth. But if you're lucky enough and well prepared enough to carry this light small instrument known as an excavator, how would you use it? So as I said, we are using the concave part of the tooth to clean, concave part of the instrument to clean the tooth. So we place this instrument into that part of the decay. Now the yellow bit is the decay or the hole in the tooth. Now this decay is involving the top part of the tooth and the front aspect of the tooth. So we place this instrument closest into the decay, closest to the center of the tooth, with the concave bit facing the front of the tooth. and then we clean it away from the center of the tooth. So it was in the center of the tooth, and we are moving away from the center of the tooth, away from the center of the tooth, and away from the center of the tooth. So we are cleaning away from the center of the tooth. Yeah. So now, what if you have an infection or a decay involving the top part of the tooth and the back portion of the tooth? So you place your instrument into the decay closest to the center of the tooth with the concave side facing backwards. And again, we are cleaning away from the center of the tooth. So it's always cleaning away from the center of the tooth. Now, why do we do that? Why do we clean away from the center of the tooth and not towards the center of the tooth? If you clean away from the center of the tooth and your instrument slips, it is still okay. If you're cleaning towards the center of the tooth and your instrument slips, you might go directly into the nerve or the pulp chamber. So that is why it's important to clean away from the center of the tooth. Now, what is the consistency of the stuff which you're going to clean from the tooth? It is like a soft, cheesy consistency, soft leather consistency. When you start reaching the consistency of like hard wooden shavings, then you need to stop, because one must not get too pedantic about cleaning everything in case you might land up endangering into the pulp chamber. So you better to let some stuff remain than rather than impinging onto this pulp chamber. Let us see how it's done. Now you see, we're cleaning away from the center of the tooth, and it is like soft, mushy consistency. And it could be like soft mush, wet leather as it peels it off. So you're going away from the center of the tooth. You're not going towards the center of the tooth, gradually cleaning out all that mucky stuff which is there in the tooth. Now, what if you are in a scenario where you don't have any fancy instrument, and a patient says that or a participant says, or a client says that they've lost a filling and they're getting a lot of pain and bleeding in that area. Now, what has happened is that the filling has popped out, resulting in a big gap. So therefore, what happens is that the bottom tooth starts forcing or plunging food into this hole. As it forces and plunges the food, like packs the food in, the food goes into the area between the tooth and gums, forced into this area, causes swelling of the gums. This causes irritation and pain. But you do not have your dental kit with you. What can you do under these situations? You can just take a floss and floss off the dirt which is collected in that area. As you remove all this mucked up dirt forced between the tooth and gums, the patient gets immediate relief. Tell the patient to continue flossing 2 to 3 times a day. Make sure there's no food collected. Once they finish flossing and remove that area, they can take a bit of toothpaste and leave it into that hole in case you do not have anything to pack that hole with. So cleaning itself can help in controlling the patient's pain and improving the patient's comfort. If you even don't have floss, you can use a matchstick, a thread, a thorn, anything just to get rid of the dirt. So cleaning forms an important part of your treatment, even if you cannot pack that area. However, if you do want to pack that area, you need to dry the tooth surface. Now, how do we dry the tooth surface? We can dry the tooth surface using a camera lens dust cleaner. This is brilliant, which is a compressed air can. Sparkies use it to clean the dashboards of a computer and just for general work. It's excellent to dry the teeth out. You can use a tissue wick, tampons, earbuds, cotton, but it's a good idea to at least clean not to have the tooth full of saliva when you're doing a temporary filling. What do we do the temporary filling with? So there's 2 things I suggest you carry in your first aid kit. One is a soothing temporary filling material known as Cavit. It essentially has a material called zinc oxide in it, and it is soothing. You do not have to mix it. It's like polyfill. It's like putty. All you have to do is to pack it into the tooth surface. The saliva, the wetness in the mouth will gradually make it hard later on. So you don't have to mix it. However, it does require mechanical locking to lock itself in in its place. It does not chemically stick to the tooth. It requires mechanical locking to hold it in. So therefore, if you have a hole or a lost filling, you can just pack it into that area. Now, how do we do that? We take this instrument, which is known as a flat plastic. Flat plastic is actually a metal instrument. Again, it's a very light instrument. It's a useful instrument to carry this temporary filling material to the hole in the tooth and pop it in. It's a good transportation vehicle to carry this putty-like material to pop it into the hole. If you do not have it, you can then use your finger just to roll this cavity or this putty-like material into a ball, pop it on the tip of your finger, carry it onto the tooth and push it in. Once you popped it into the tooth, push it in with your finger so it's held there, and this is what it should look like. Okay, now here we go. So basically we're taking a flat metal instrument, scooping it out of the tub. Once you scoop it out, it's always a good idea to massage it a bit to get the oils back to the surface, and it's much easier to use it then. You carry it onto the tooth surface, pop it in using your flat plastic, then you can use your finger or a damp cotton swab and just flush it to the sides. And then you tell the patient to bite on it so it gets firmly impregnated into the tooth surface. Once you've done that, you ask the patient to bite and ask the patient, how does it feel? Does it feel high, as if he's biting on the filling before the teeth? If he's doing that, shave the bit of it off. However, if you want to be doubly sure, you can use any sort of a charcoal paper, carbon paper, marking paper. Tell the patient to bite on it. When the patient bites on it, anything marked out with a prominent dot is the part which is higher than the level of the tooth. Now, if you don't flush it down, if you don't make sure that the filling is not interfering in the patient's bite, what will happen is that once it sets and the patient bites on it, the patient will get more pain or the filling will break and it will be much harder to adjust it then. So the best time is to adjust it now. So the patient bites on this marking paper, you see a prominent dot, you take your flat metal instrument and you scrape it off. Keep doing that till no more dots show up on the filling. So the filling is now below the level of the bite and the patient will be much more comfortable. So this is what the filling will look like. And essentially it will take 20 to 30 minutes to set, and the patient can eat softish food after 2 to 3 hours. Now, we did discuss the next scenario when a tooth is broken, and your aim in that situation is to cover the tooth and to protect the tooth. So that is Mark Beaumont's tooth, who was cycling around the world. He fell off, his bike went into a porthole and this tooth fractured. So this was needed to be covered up. So how do we do this? Essentially, we use this material. This is the second thing I advise all dental first aid kits must carry. One is cavit, next is glass ionomer. Why? Because glass ionomer is adhesive. It is an excellent intraoral bandage and it chemically sticks to the teeth. So it sticks like super glue. However, this has to be mixed. So there's a powder and a liquid. So basically, you scrape the powder, put 2 drops of liquid to 2 scoops of powder. It all comes as a kit. You mix it for 1 minute. It is like a chewing gum consistency, and you have 1 minute working time. So you take this putty-like material and then you can pop it onto the tooth surface. Now there's a certain thing to remember, is to read the instructions which come in the box with this kit. And the instructions will tell you whether this bottle should be empty or should have liquid in it. In some of the kits, this is empty. It is like a measuring bottle. You use plain tap water as your liquid and you mix it. Some kits, you do have to have a specialized liquid in it, which is full of it, and that is what you mix it with the powder. We often get calls from individuals to say, oh, the liquid has leaked out of the bottle. Actually, it was not supposed to be in the bottle. The bottle was a measuring bottle, and therefore it's quite important to read the instructions which is there in this box. So you got your broken tooth, you take up the material which you mixed, which is like chewing gum consistency, and you pop it onto the surface of the tooth, covering the tooth surface, and that is how it works as an intraoral bandage. The tip is to clean your instruments immediately after you've done this. Otherwise, it gets very hard to clean the instruments afterwards. Now, this next problem is my gums hurt. Why should the gums hurt? Because food collects between the teeth. Either it's a broken filling or bad oral hygiene. Food is collecting there, causing pain in the gums. Bad oral hygiene, where dirt is collected all around your teeth, causes pain. And last reason could be ulcers in the mouth causing gum pain. So what is your objective in both of these two scenarios? It is to clean all that dirt away and to maintain the patient's oral hygiene and give him or her possibility of mouthwash. Oral ulcers. Your aim for this would be to provide some degree of pain relief and to treat the underlying factor. So let us look at infected gums. So the patient will come to you and says, Doc, every time I brush or floss, my gums bleed, and they bleed so much that I stopped brushing and flossing. When you open the mouth, what you see is inflamed, red and swollen gums. Now, why did this happen? This happened because food and debris was collecting on the teeth and in between the teeth. So they caused irritation of the gums. The irritated gums got inflamed. Because they got inflamed, they are at a higher level now than normal gums. So they form a little pocket between the tooth and the gums. It gets harder to clean in the pocket. So more food and debris collects in the pocket, worsening the whole situation. And gradually the patient lands up into a vicious cycle where food and debris collecting, inflamed sore gums, he or she doesn't brush and floss, and the whole thing keeps going on, and they lose the foundation around the tooth, resulting in advanced gum disease. So what should you do under these circumstances? You have to advise them that wherever it bleeds, to brush better, to floss better, and that would control this problem. What else you can do is to take some mouthwash, which generally we recommend as a cortical mouthwash, which is very good for gums because it has chlorhexidine gluconate, a medicine in it. If you don't have this mouthwash, you can use warm salt water. Using this, you flush the area around where he or she is getting bleeding, wash off any debris which is there using this medicated mouthwash, and then advocate the patient for a better brushing and flossing to maintain that area, otherwise the whole thing will get repeated again. Oral ulcers. You could have a scenario where the patient will come to you and says, the patient, let's pretend that the patient is cycling up high in the mountains in Tajikistan. High altitude cycling. The key on this, or the clue on this, is that the patient has been exposed to dry air and wind on the face. The patient complains of multiple painful ulcers in the lips and gums. What do you see when you open the mouth? Multiple ulcers all over the mouth, scabbing all over the mouth. Now, why did this happen? This can happen for various reasons. Can happen because of UV exposure. Can happen because of high altitude and dry air, whereby if you had a small ulcer caused by UV exposure, the healing time because of the high altitude and dry air is considerably increased. It can be increased from up to 1 week to 6 weeks, just with the exposure of the environment. Also, the exposure of this dry air and high altitude causes dehydration. And this dehydration would require the patient to consume at least 2 liters of fluid an hour. If the patient has not been continuing with the rehydration, the patient is dehydrated. The patient could be immunosuppressed with the exertion, bad diet, oral and dehydration. The patient could be allergic to the medication or the sun cream she has been using on the lips. Does the sun cream have PABA in it, where quite a few of the patients are predisposed to allergy from the sun cream? Or the patient could just generally be autoimmune, depressed for other medical reasons, or be exposed to a lot of stress, which is aggravating this whole situation. So it could be multiple factors which brings about these ulcers. So what can you do under these circumstances? Lip balm. So essentially, if she says she's putting lip cream, what sort of lip cream she's putting? A, where did she get it from? Is the quality good? Was it got from a reliable source? Does it have enough sun protection in it? Because sometimes SPF 30 may not be enough. She might need to use a lip block, something which the cricketers use to provide enough protection on the lips. What can you do is also create an environment which is favorable for the ulcers to heal. Antibacterial mouthwash like Coscidal mouthwash will help and decrease the healing time of the ulcers. You could provide pain relief if you have in the form of lignocaine cream or lignocaine gel. This could be mixed in her lip cream just to give her a good night's sleep to get rid of all that pain in the mouth if you have that. Protection of the lips while cycling, putting a bandana across while cycling will protect the lips from the excessive wind, from the UV light to a certain extent, and also as she mouth breathes, it will moisten the dry air and warm it a bit as she inhales. This will help in further decreasing the healing time. But what I want you to take from this particular case is a holistic approach. You have to check that the patient is not dehydrated. So we have to think about the mouth, but think of the body also. Make sure that the patient has enough hydration. She's consuming up to 2 liters of fluid an hour. Check the diet. Is it sufficient and it is of a decent quality and quantity which she's consuming? If at the end of the day nothing works, and if it's possible, then rest and recovery will help. And the last scenario with regards in this field is oral thrush. So let us imagine a scenario that the patient says that my mouth and gums are really sore. The patient is on a base camp walk in Kathmandu and it has gone to the base camp and it has just got worse and worse. But the clue you can get here is that the patient was asthmatic and was on a steroid inhaler. When you look into the mouth is angry red with like white patches all over the mouth, going all over the roof of the mouth, tongue, everywhere else. Now, why did that happen? That happened because the patient is asthmatic. She's using steroid inhalers. But she has not been rinsing her mouth after using steroid inhalers. This, together with the stress caused by the physical exertion, high altitude, dehydration, poor diet, all these things are working together causing oral thrush. So what can you do is first is to prevent it. If the patient is on oral or steroid inhalers, is to advise the patient to rinse the mouth religiously after every single puff or steroid inhaler. You can create an environment which is favorable for healing using Coscidal mouthwash or Coscidal gel. If again, you can create an environment which is unfavorable for oral thrush growth. Natural yogurt changes the pH of the mouth and prevents thrush from proliferating in the mouth. So if you can get access to that stuff, that is good. But again, think of the patient holistically. Is the patient consuming enough fluid every day? Check the hydration levels, check the diet, if at all, rest and recovery if possible. Now, let us look at the other factor, which is my face hurts. Why should the face hurt? The face hurt because there is an abscess originating from the tooth causing the swelling of the face, or there's an abscess starting from the gums, a gum-based abscess, or it is a wisdom tooth which has not come fully in the mouth and there's an abscess in relation to the wisdom tooth. Now, the treatment for all of these is essentially on the similar lines, is that you got to make sure that the patient does not put anything hot on the outside of the face. Any heat on the outside will cause the swelling to migrate to the outside, worsening the situation. So no extra oral heat. Make sure the patient is maintaining a good food and a good intake of fluids. Contact the medic on call. Possibly the patient will need some painkillers and antibiotics. So let us look at dental abscess. The patient will say that, "Doc, when I eat, there is a tooth that really hurts. It hurts even more when I'm biting. The tooth may not necessarily be sensitive. It is just painful when I bite on the tooth." When you look in the mouth, you might find a tooth which is broken or a tooth which had a deep filling and a big abscess in the gums, a boil in the gums surrounding that particular tooth. What is happening is that the tooth has now died. There's dead meat in the center of the tooth. The dead meat is releasing acids and gases which are leaking out through the tooth, going to the bone around the apex of the root, dissolving the bone around the apex of the root, causing a periapical abscess. Now, when the patient bites, it stimulates the nerves in the bone around this abscess, and this causes pain. And also he can locate which tooth it is, because every time you tap on that tooth, the patient gets pain. So what would you do under these circumstances? The patient will need antibiotics and paracetamol. Make sure that the patient does not put any heat on the outside of the face. Suggest soft liquid diet to be consumed from the opposite side. You want to rest the infected side. If it's really painful, then the patient can bite on a piece of gauze, which prevents the top teeth hitting the bottom teeth, causing worsening of the symptoms. The patient has to be contacted, or the emergency medic has to be contacted to deal with this patient. The other thing is the wisdom teeth. Wisdom teeth can happen in young, fit individuals. The patient complains that its face really hurts and he or she cannot open her mouth because of the excessive pain inside it. And you look into her mouth and that is what you see, a small white tip at the back and red angry area here. Now, what is that? That is the top part of this wisdom tooth. This wisdom tooth has just partly come in the mouth and is covered by all these angry gums. So what had happened is that because it's covered by a flap of gums, a pocket exists between the tooth and the gums. Food and debris collects in that pocket because it's really hard to clean in that pocket, which is between this wisdom tooth, which is partly in the mouth, and the surrounding gums. So food and debris is collecting there. This food and debris irritated the gums. The irritated gums get so irritated that they close their own opening up, resulting in a cave where food and debris is collected. The top teeth then bite on it, worsening this whole situation. What can you do? The patient will need some antibiotics, will need some painkillers. It could possibly need either costal mouthwash or warm salt water to flush out all that dirt which is collected between the tooth and the gums. Just get rid of all that irritation. An emergency medic will need to be contacted. Now, if you notice, I was trying to avoid giving anti-inflammatories. And the reason is that in extreme athletes or athletes involved in extreme endurance events, we do not want to give ibuprofen. Why is that? Because these athletes have very high rates of dehydration. This is causing reduced blood flow, breakdown of muscle tissues, which is going through the kidney. So the kidneys are damaged or not functioning at the extreme extent. We do not want to add to this kidney injury by adding ibuprofen in the mix. So recently, there are lots of articles which have stated by adding ibuprofen or giving ibuprofen to extreme athletes increases the kidney damage. So one has to be careful, and if it needs to be given, you must contact your emergency medic on call and then decide whether to go ahead with it or not. Dental injuries. Dental injuries which you can come across is a broken tooth, and we discussed that. Or you can have a situation where the front tooth has been knocked out. In this, your part is incredibly critical. Or you could have a broken jaw. So your aim for a broken tooth, as we discussed, is cover and protect and contact the medic, and the patient would have to be referred to the dentist. If the front tooth is knocked out, your aim will be to get that tooth back in as soon as possible. Then, of course, contact the medic, and the patient would have to be referred to a dentist. If there's a broken jaw, then we follow our standard protocols of airway, breathing, circulation, disability, exposure, inform the medic, stabilize the patient, contact the medic about the situation, and possibly, I'm pretty sure the patient would need a Medivac. So how do we deal with a front tooth that has got knocked out? Now imagine that is your front tooth, okay? And this is quite useful to have on a long-term trips. What it is a nasal clip of a face mask. So the first thing to do, if a front tooth is knocked out, a blood clot takes 8 minutes to form in the socket. So if it's immediately there, of course blood clot is not there, but if 4 to 8 minutes have gone by, there's very likely a high chance of a blood clot being present in the socket. So first thing you got to do is to remove the blood clot. When you remove the blood clot, you just gently rinse it out or take a tweezer to gently take it out. You try not scraping the side of the socket with your tweezer, because that we want to protect the sides of the socket as much as possible. Just take out the blood clot from the socket. Local anesthesia is not essential. It's preferable, but not essential. So you can do that on site, and this has been done on site. Next, grab the tooth. Hold the tooth only by the crown. You're not supposed to touch the root at all. The root is sacrosanct. So just hold the tooth by the crown. So see that? We're only holding the tooth by the crown. Then you can rinse off any visible dirt from the tooth. Not for a long time, maximum for 10 seconds. What then you can use? You can use warm salt water or milk just to gently rinse the tooth. You're not supposed to use any chemical agents, any vicious agents. You want to preserve the tissues as much as possible. So just gentle rinsing just to get rid of any visible debris. Okay. Next, check the adjacent teeth, because you do not want to push the tooth the wrong way in. Check the adjacent teeth. Grab hold of the tooth and using a firm digital pressure, push it in till it is in sort of alignment with the adjacent teeth. Your objective is to get the tooth back into the socket as soon as possible. So see that? We pushed it in. Now it is in sort of alignment with the adjacent teeth. Next, tell the patient to bite on a piece of ballpoint pen, wooden spatula, plastic biro, anything like that. And as the patient bites on it, wait for 4 to 8 minutes. So this is the time to make your dental splint. What happens in this 4 to 8 minutes? In this 4 to 8 minutes, a blood clot forms around the tooth. So initially, the oral environment is wet and bloody, and after 4 to 8 minutes, once the blood clot forms, the saliva in the mouth decreases, the whole area is cleaner, better, and more conducive to work in. So take the nasal clip of your face mask and put it across the tooth. It is placed midway between the gums and the top of the tooth. Okay, the ends of it go between the adjacent teeth. How long should the nasal clip be? The nasal clip should extend 1 to 2 teeth on either side of the naughty tooth. Now, what if you don't have a nasal clip? What can you use? You can use a steri strip if you have that as your nasal splint, as your dental splint. You can use wound glue or surgical glue just temporarily as your splint, or you can use a combination of both of them. To use a safety pin doesn't quite work. Once you put the splint in, remember that adhesive intraoral bandage I described, which is the powder and liquid called glass enema. That is what we use. So we take 2 scoops of powder, 2 drops of liquid, 1 minute to mix it with, 1 minute to use it with. Let us see how it works. So read our instructions properly. We've taken our powder as per our instructions stated, and we looked into the instructions, and this one did have liquid in the liquid bottle. We've taken 2 drops of liquid, and then all this comes in your kit. Okay, so we put 2 drops of liquid in because that is what the instruction manual told us, and then we take a spatula and then we mix the powder with the liquid. So we mix the powder with the liquid to make it into a putty-like consistency or chewing gum-like consistency. So it is like that. So that is what we use. We plonk it on top of the splint covering the tooth. So the splint is already here. We plonk it on top of the splint covering the tooth. Here, here, here. So at all the teeth, we covered the splint with the filling material, which is glass enema. And that is what is going to hold the splint onto the tooth. Okay. Now, after this, the patient must go to the dentist as soon as possible. The longer the patient waits, the lower the chances of a success are. But if you can get the tooth into the mouth and splinted in the first hour, then the success rate is 80%. After the first hour, the success rate drops to 20%. So that is why this is such a time-critical emergency. However, if you are not confident of putting the splint in onto the tooth and doing this procedure, and you want to transfer the patient off to the emergency medic, how do we transport it? So we take the tooth, and the tooth is placed into the floor of the patient's mouth or into the side of his cheek, between the tooth and the cheek. So either you put it between the tooth and the cheek or below his tongue here. So it's resting in the warmth of his saliva. It is a good transportation medium. However, if the patient is too shaken up to have this done, you can tell the patient to spit in a bowl of container and then put the tooth, which is now in the patient's own saliva, in the bowl. Even if this is not possible, then the next transportation medium you can think of using is milk. Okay. Once you're done the splinting, if you cannot medevac this patient, then the patient, in consultation with your on-call medic, will have to be placed on a long-term, on a broad-spectrum antibiotic for 7 days, anti-inflammatories. His tetanus booster situation will have to be checked. But the key would be is to maintain a good oral hygiene. Good oral hygiene around the tooth. If you have coccygeal mouthwash or coccygeal gel, you must give it for 7 days after this event. Ideally, he should be medevaced, but it depends on him. And of course, the medic in charge will have the final say in this matter. If you do not have glass enema, what other choices of splints can you use? Compeed does make a very good splint. It is very sticky and can hold the tooth in place quite well. If you have a blue tack, soft cheese, anything like putty, this will not chemically stick to the teeth, but physically will sort of hold the teeth in place the same way as your silver foil does. But the most useful for you, if this occurs in a running event where the emergency medic is accessible but far away, is to pop the tooth back in as soon as possible, tell the patient to bite on a piece of gauze, contact the emergency medic, and immediately shift the patient to an emergency medic. In case your endurance athletes are a child, we do not reimplant milk teeth. This is just an information. And in the last situation, let us discuss mandibular or jaw fractures. Imagine you're having an endurance event in Kyrgyzstan. This happened there, and somebody slips, fractures, and breaks the jaw. What would you do under these circumstances? After a quick primary assessment, you'll contact base camp, inform them of the situation, and seek for help. Your objective would be to prevent the patient from going to shock, stabilize the patient, and transport him to a location where the emergency medic can have a look at the patient. What if the patient starts feeling dizzy, and by history you know that the patient hasn't eaten or drunk anything for a long period of time? Your idea will be to get some food or fluid into the patient's mouth as soon as possible. However, if the patient is having difficulty in swallowing, what you can do is to grab the tip of his tongue, pull his tongue downwards and forwards. This exposes the back third of his tongue, squirt some gel into the back third of his tongue, raise his tongue upwards and backwards. This forms a natural tunnel which will allow the gel to go into the patient's mouth. Next, we want to stabilize the patient for his transportation. Now, what you can do is to support the jaw for this transportation by using a simple buff or by tying a barrel bandage. Now, how do we tie a barrel bandage? This is quite a useful bandage to know just to support the face for your transportation. It's your emergency medical bandage, and it's quite useful to know it. How do we do it? Is that we take a long tubular piece of cloth. The center part of this tubular piece of cloth goes below the chin, stretching from the chin all the way along the lower jaw. So it's below the chin here. Then you hold the two ends and put upwards and backwards traction. Tell the patient to support the chin and the bandage and the lower jaw, just supporting the lower jaw and supporting the bandage both at the same time. Now you got two ends here. One end goes all the way to the top of the head, goes over and you cross it just above the ear here. You're crossing it just above the ear here, and you got two tail ends then. Tell the patient again to support it both in the lower area and the lower jaw as well as on the top of the head. Now these two tail ends, the back one goes behind the skull or the occiput, goes all the way around here, and the front one goes just above the eyebrows along the forehead here. This is then crossed on the opposite side of the head, just above the ear. So it's crossed one ear, goes around the head, crosses to the opposite ear, and that is where you tie a knot and tuck it into the adjacent bandage. So that is what you hope to achieve. So here we go, goes all the way along the lower border, goes below the chin along the lower angle of the mouth, top of the forehead, crosses over the ear, across the forehead, and over the opposite ear, and that is where you tie your knot in, and you tuck the free ends in. So that is how you tie a barrel bandage. Now, what is a clinical application for you as a non-medic? Through this talk or through this session, hopefully you will have picked up tips for the early recognition, how to assist and manage a dental emergencies. You would have sort of got the gist of where you can do the emergency management or where you require to get urgent assistance. Also in the situations where Medivac is highly likely to be possible. So therefore, you will be a part of the team which will help in the assessment of the patient, in the differential diagnosis of what actually is happening in the patient. You'll be able to communicate the details better, and therefore you'll help in the overall management of the athlete, which will make the whole event much more safer for the athlete and much better managed. We will go through any questions on the live session. Otherwise, thank you very much. It was a pleasure discussing this with you all.